There is a quiet moment that happens inside the human chest every second of our lives, a moment so ordinary that we forget its miracle. A muscle tightens, relaxes, and sends life forward again. Yet, when that rhythm is disturbed, when the heart struggles even briefly, the body does something extraordinary. It releases tiny biochemical messages into the blood, silent witnesses of stress, injury, and survival. These messages are what we call cardiac enzymes, and they are not just laboratory numbers, they are the language of the heart speaking to us when words fail. Imagine the heart not as a mechanical pump, but as a living, sensing tissue, deeply aware of its own limits. When heart cells are healthy, they keep their contents carefully contained, working with remarkable efficiency. But when oxygen runs low or blood flow is interrupted, those cells suffer. Their membranes lose integrity, and enzymes that once worked quietly inside now spill into the bloodstream. In this way, the body tells its own story. It does not shout, it reveals. Cardiac enzymes rise gently, then clearly, tracing the timeline of injury with scientific honesty. From a biological perspective, these enzymes are tools of metabolism, molecules designed to sustain life. From a clinical perspective, they become markers, evidence that something meaningful has occurred. But from a human perspective, they represent vulnerability. They remind us that even the strongest organ depends on balance, nourishment, and care. A blood test may detect troponin or other enzymes, but behind that result is a moment when heart cells asked for help. What makes cardiac enzymes fascinating is not only their diagnostic power, but their precision. They rise when damage occurs, not when fear occurs. They do not respond to anxiety or imagination, they respond to cellular truth. This is science at its most compassionate, objective, yet deeply personal. It allows clinicians to distinguish between pain that frightens and pain that harms, between temporary stress and lasting injury. In doing so, it protects patients from both neglect and unnecessary intervention. Yet these enzymes also invite reflection beyond emergency rooms and laboratories. They raise a quiet question. What are we doing to our hearts long before enzymes appear in the blood? Long before cells break and enzymes leak, the heart responds to daily habits, what we eat, how we move, how we sleep, and how we carry emotional weight. Chronic stress tightens vessels, poor nutrition weakens resilience, inactivity dulls circulation. The heart remembers all of it long before science measures it. When we understand cardiac enzymes, we begin to respect prevention as much as diagnosis. We realize that the goal is not just to detect damage, but to protect the tissue so those enzymes remain where they belong, working silently inside healthy cells. Light exercise improves oxygen delivery. Balanced meals support cellular repair. Calm breathing steadies rhythm. Kindness toward oneself reduces invisible strain. None of these appear directly on a lab report, yet they shape every future result. In this way, cardiac enzymes teach us humility. They show us that life leaves traces, that suffering is measurable, and that healing begins with awareness. They remind us that the heart is not only an organ of circulation, but an organ of experience, responding faithfully to how we live. Science gives us the tools to listen, and wisdom asks us to act gently, consistently, and with respect for the fragile intelligence beating within us. Cardiac enzymes are biochemical signals released when heart cells experience injury or stress, and this process reveals a profound truth about how the body communicates. Under normal conditions, heart muscle cells are highly organized and protective, keeping their enzymes safely enclosed where they support energy production and cellular balance. When blood flow is reduced or oxygen becomes scarce, these cells struggle to maintain their structure. their membranes weaken, and enzymes begin to leak into the bloodstream. This leakage is not random or accidental. It is a direct biological response to injury. The body is, in essence, reporting what the heart has endured. These enzymes rise in a predictable pattern, allowing science to read the timing and severity of damage. What makes this remarkable is that the heart does not hide its suffering. At the microscopic level, it transforms stress into measurable signals, turning invisible cellular pain into information that can guide care, understanding, and healing. These markers reflect cellular truth, distinguishing real tissue damage from fear or temporary discomfort. And this distinction is one of the quiet triumphs of modern medical science. The human experience of chest pain is complex, shaped by emotion, anxiety, muscle tension, and even memory. The heart, however, responds only to biological reality. Cardiac enzymes do not rise because a person is afraid or stressed. They rise because heart muscle cells have been deprived of oxygen or physically injured. In this way, enzymes act as impartial witnesses. They separate the language of emotion from the language of cells. This protects patients from both extremes, being dismissed when damage is real or being overtreated when fear mimics disease. At a deeper level, this reminds us that the body operates with honesty. It records what truly happens, regardless of how we interpret our sensations. By listening to these biochemical signals, medicine learns to respect the difference between feeling unwell and being biologically harmed, offering care that is both precise and humane. Their precision makes them powerful tools for timely, compassionate medical decisions. Because cardiac enzymes do more than confirm injury, they guide action. When these enzymes appear in the blood, they do so with a rhythm of their own, rising, peaking, and gradually falling. This timeline allows clinicians to understand not only if damage has occurred, but when it began and whether it is ongoing. Such clarity is critical in moments where time carries weight. Early detection can open doors to treatments that restore blood flow and preserve living tissue, while delayed recognition can mean irreversible loss. Yet, this precision is not cold or mechanical. It serves human urgency. It allows doctors to act quickly when intervention can save muscle and to pause when aggressive treatment is unnecessary. In this balance, science becomes compassionate. The accuracy of cardiac enzymes reduces guesswork, fear-driven decisions, and delay, replacing them with informed care that respects both the biology of the heart and the vulnerability of the person whose life depends on its rhythm. Rising enzyme levels remind us that lifestyle choices influence heart health long before emergencies occur, acting as a late echo of much earlier patterns. Cardiac enzymes do not suddenly appear without a history. They are often the final chapter of a long, silent story written by daily habits. Long-term poor nutrition can stiffen arteries and burden heart cells. Physical inactivity reduces the heart's efficiency and resilience. Chronic stress narrows blood vessels and alters hormonal balance, quietly exhausting the cardiovascular system. None of these changes cause immediate pain, and none trigger alarms in the moment, yet over time they weaken the heart's ability to cope with sudden strain. When enzymes finally rise, they reflect not just an isolated event, but accumulated biological fatigue. This understanding shifts responsibility away from panic and toward